Thank you, everyone. Thank you for that. Amen.
Amen.
So welcome. This is part two. You'll remember, those of you that were here last week, we had divided our agenda into two parts. We had a chance last time to address and assess some self-assessment of secondary stress, the secondary stress that we experience and the vicarious trauma that we might experience as a person of faith and ministry. In ministering to our community members, to our parishioners, our students, families, etc., during this time of the COVID-19 pandemic, and during this time of demonstration and activism, in standing up against racism and dealing with the stress that is very much palpable within our communities at this time. We talked about the importance of starting with ourselves, with self-assessing and understanding our own needs in order to then be able to pivot outward and reach out and be of service to those around us. We began to describe a framework for helping faith-based communities cope with the mental health challenges posed by the COVID-19 pandemic. And we focused really on five basic movements, yes. Number one, in helping someone in a state of crisis, helping them to feel safe. Safety was the first movement, right? Trying to understand how they feel safe or how they don't feel safe in that particular moment. Then moving from sort of establishing a sense of safety to establishing a sense of calm, helping the person to be calm in the moment, calm in their mind, calm in their bodies, to be able to connect with the person. We talked about using strategies that foster and develop self-efficacy, helping people to feel that they are in control and that their actions actually matter in the midst of a crisis. People in crisis often feel like they have no agency. The fourth moment that we talked about there, or movement, was about connectedness, reestablishing a sense of connection for people with their sources of strength, both within themselves and across the social world with their local communities and others. And the fifth and final sort of organizing movement or principle that we discussed were strategies that reinstill a sense of hope, a sense of hope. And so we began to articulate a framework that can give us some big, broad brushstrokes of what we're going to try to achieve in the limited amount of time that we have when we are addressing a moment of crisis and trying to be of assistance to someone in a moment of crisis. Today, we will shift now to part two and learn the basic principles of psychological first aid and how they can be presented to not only the bilingual Latina community, but specifically to other members of our community that really need the help and that may not get the help otherwise. And as I mentioned before, psychological first aid is really designed to be deployed, to be used, to be shared in a time of crisis. And right now we are still in a moment of crisis in terms of dealing with the social unrest that exists in our communities because of COVID-19 and also because of the chronic effects of racism that are really coming to a forefront at this time. Once we are able to move, God willing, hopefully soon, from a moment of crisis to a moment of recovery, then there's another set of skills that can come into play there. We call those skills for psychological recovery, a framework that can assist with that recovery period, but we're not there yet. So we're really going to focus on this crisis period and what we can do by focusing and learning about psychological first aid. We talked about the opportunity for a unique partnership between our faith-based communities, such as the Archdiocese of Los Angeles and the LA County Department of Mental Health, and the program that we're trying to foster and develop in partnership with you all. And so I'd like to give just a moment right now to my colleague, Dr. Jorge Partida, who was with us last week as well. Dr. Partida is the chief psychologist for LA County Department of Mental Health. And I'd like to invite him to just share a few brief words with us here about this partnership that we're advocating for. Dr. Partida, welcome.
Thank you, Higas. Thank you so much. And Isaac, thank you so much for the invitation and for this opportunity for us to partner. We at the Department of Mental Health recognize the importance of serving our underserved communities and recognize the importance of churches and our faith-based community in this initiative, as many of our representatives and residents feel often much more comfortable asking for help and going to seek help in churches rather than in government organizations. And so to that end, we want to bring the help where the help is most needed, hoping that we're able to educate our community about the importance of mental health, not just as an intervention right now to address the crises that we are facing, but also to prevent future and deeper harm to our community by not being able to address these issues and concern on time. We know as a community that there is much yet that we need to learn about the importance of mental health, not just for our own personal well-being, but also to help intervene with our children and families. Whatever we can do today to prevent further harm, we're going to be able to reap the benefits of that for years to come. It is through these initiatives, this work together, that we're able to prevent and minimize the high rates of abuse, whether it's substance abuse or physical abuse, suicide attempts. We know that there's serious decisions coming down on Monday for DACA that is going to impact our communities in one way or another. All of these issues, I think, are so critical for us to be able to address from a faith perspective and from a mental health perspective. So thank you, Dr. Cajigas. Thank you to our Hispanic Neuropsychiatric Center of Excellence, to Isaac Cuevas, to all of you at the Los Angeles Archdiocese for opening up your doors and your hearts for this partnership. And I look forward to further collaboration. Thank you and enjoy the training.
Thank you, Dr. Partida. Okay. So with that, I want to invite you to be participants in the time that we have together here. Feel free to ask questions, ask for clarification, to make comments in the chat. We want to hear from you. I'll do my best to monitor that, and Isaac will help me to make sure I don't miss anything.
Absolutely, and I think that's going to be the best part of this session is the more questions we get, the more we can get introspective with what you all are doing in ministry and how these two areas can coincide. So please, very much we encourage you to ask questions and to participate.
Okay. So how to maintain mental health in times of crisis. As I mentioned, psychological first aid and skills for psychological recovery are two frameworks that were designed to help assist people on large scale to deal with large scale crises in mental health. The literature and the evidence base for this really did stem from working with people in health emergencies, right? Health emergencies, viral outbreaks, large disease outbreaks, as well as natural disasters like hurricanes, earthquakes, and the like. And so these skills that we're going to be talking about are really designed to be deployed in a time of crisis, and to be focused on helping the greatest amount of people to get the greatest benefit in as short a period of time. And you can expect that about 70% of people that you interact with, that you can share these skills with and encourage them to share them with others, will have positive responses and will be able to weather the storm, if you will be able to refocus and recenter and benefit in terms of their mental health by engaging with these skills. There is, however, a group of people that will require greater help, right? A more formalized intervention. And for those folks, that's where this partnership with the LA County Department of Mental Health and having a warm handoff and a bench, if you will, that you can rely on for help at the individual community level will be of great assistance. So what is psychological first aid, or PFA? It's a short-term aid that can be used immediately in the wake of a traumatic event. That's what it's designed for. And it's important to get in the right frame of mind. Some of you may have greater experience as therapists, as people that are involved in pastoral counseling, maybe have taken other trainings that help you to create a more deep type of therapeutic relationship with someone. But as we talk about psychological first aid, it's important to recognize that we're talking about being first responders in a time of crisis. And so the interventions are geared for that first response type of encounter with people. It can be provided anywhere. It's flexible. The method, the framework is flexible and can be adapted so that you can do it anywhere. You can do it on the phone. You can do it on Zoom via telehealth. You could do it in person. And so it's important to recognize that it's portable and easy to adapt. It consists of quick assessment of the immediate concerns and needs of the client. It's very focused on the here and the now. We're not going to help people solve all the world's problems. We're not going to help someone solve all the chronic issues that they have been dealing with in their life. But we are going to be able to help them to refocus, to recenter, and to regain a sense of hopefully well-being in the midst of this crisis. It's focused on interventions that can be adapted for different age groups, for different cultural groups. And you're going to see as we work through the method, these 8 steps, how you'll be able to adapt to different situations and contexts. I think it's important, and I've already discussed this to some degree, to really orient the space of where psychological first aid comes into play relative to other forms of intervention, relative to, for example, specialized services that might be provided by a mental health care professional, as well as where it comes in terms of other types of community and family supports, programs that are designed to strengthen community and family supports, as well as the most basic needs which people need advocacy for in terms of, you know, safety, the protection of their well-being in terms of affordable housing and access to food insecurities. And so psychological first aid really is on a higher level, but it's just below the more formal sort of psychological services. So it's important to know where this stands in the broader scheme of things. Okay. So here are the structure of actions to take. These are the 8 key points. I'm going to give a quick overview, and then we're going to go into each of them more individually to do a more fine-grained analysis and get a better understanding of what do I actually do in each of these moments. So action number 1, contact and engage. This is the very, very first step when you're responding to that client-initiated contact, right? Or to that initiation of help from someone in your community. You want to do it in a compassionate, helpful, and respectful way. All of the different psychological interventions suggest that there's one factor that explains the success of different types of therapy. Now, it could be cognitive behavioral therapy, it could be rational emotive therapy, it could be any one of any type of therapeutic modalities, but there's one factor that explains what we call the lion's share of the variance, or explains why the therapy works. And that's something that we refer to as the therapeutic alliance. How aligned does the person feel that you are with them? How supported do they feel in the moment? How much of a sense of trust do they feel that they have with you? That they understand that you're there to be helpful, and that you're in an unconditional way just going to listen to them and help them to the best of your ability. That therapeutic alliance, even in more formal types of therapeutic settings, really explains what helps people the most. And so in this first step of contact and engage, you want to work on developing that therapeutic alliance. And we're going to talk about how you do that in just a few minutes. From there, once you have that alliance, or the building blocks for that alliance in place, how can you provide an immediate sense of safety and comfort for the person? The objective here, again, improve their immediate sense of security, provide physical and emotional relief in the moment with them right then and there. This is important because the person needs to be in the right frame of mind. You can't really move on to deal with other types of mental health challenges if the person doesn't feel safe, if they're in the middle of a domestic violence situation, or if they don't know where they're going to find the next meal for their family, or if they are in danger of losing shelter and not being able to have a place to be safe physically. And so providing that sense of safety and comfort is the second structural action in PFA, or psychological first aid. Number 3, stabilization. How do you help to calm and guide your patients, your clients rather, or your community members who are emotionally overwhelmed and maybe disoriented, maybe hypervigilant and scared? How can you help to stabilize them in the moment so that they are receptive to what you have to say, so that they're in a place where they can think a little bit more clearly? Notice that it's only after we engage in these first 3 core actions that we come to the point of gathering information. We don't attempt to gather information right off of the bat. We have to meet the person where they are in a humanistic, therapeutic stance of that contact and engage phase. We have to get a sense of whether or not they feel safe and what the threats are to that safety. What is keeping them from feeling comfortable in the moment, here and the now? And then they have to be in a frame of mind and in a physical state of calm, right? We want to stabilize their feelings in the moment as much as possible. It's only then that we have a shot at really being able to gather information, that we have an opportunity for people to really open up to us and allow us to work with them to identify what are their most immediate needs and concerns, right? How can we collect additional information and that is going to help us to adapt our psychological first aid interventions? How can we get to that place of gathering information to really understand with that particular person what it is that is burdensome to them, what it is that is the basis for that burden on their mental health? I cannot overstate or stress to you the importance of the first 3 actions in order to get to a place where we can begin to understand what it is that the person needs help with. Okay, so this first half of PFA, and as I said, we're going to go through this systematically in greater detail, is all about getting us to the point where we can then take some action. But notice that, again, there are 4 steps before we take any real action. In the 5th step, we focus on giving practical assistance that can help people to respond, again, within a frame of their immediate needs and concerns. This is where we can get a real handle on what it is that the person needs help with, helping the person to prioritize their worries, to prioritize their concerns, to make it explicit. But you're really not going to be able to get there unless you can get through those first 4 steps, the first 3 in particular. At that point, you want to begin to reconnect the person with the support systems that are available to them. their primary sources of support, and those auxiliary sources of support around them. Start with helping them to identify who they can rely on. It may be a very, very short list. It may be that they, in that brainstorming session with you, can identify other sources of support in the network around them that can be marshaled, because you're going to have limited time with them, and you can't walk with them the whole way. Yes. And so in that limited time, you want to help them to begin to reach out to other people. You'll notice there's some overlap with the 5 movement framework that we spoke about last week. That one starts with safety, right? And then moves to calm, and then to self-efficacy, to coming up with a plan of action, that my actions matter, to connectedness, and then to hope, right? And you can see the overlap between that overall framework that we talked about last week and the structural actions that make up psychological first aid. After trying to expand that person's understanding of the resources that are available to them for support, we can then begin to discuss active coping strategies, to provide information on typical stress reactions, trying to normalize what it is that's happening. It's perfectly normal and healthy, actually, to respond to a stressful situation by reacting to it. That way you know there's something there that could be dangerous or that is upsetting. But it's becoming aware of those stress reactions and understanding that they're not permanent, and that they're actually amenable to change from certain techniques and strategies. Helping the person to begin to manage these adverse stress reactions, right? And to reduce their level of distress and reconnect them in a more adaptive way of functioning with their environment, with the people around them, and even within themselves. So at that point, and we're going to talk about specific coping strategies that can be used, you will be able to see, if you trust the method, you'll be able to see people begin to open up. You'll be able to see them begin to think more clearly again, and weather the sort of the fog of crisis that can envelop people so often. The final piece to psychological first aid is the linkage to other services. How to connect those that are seeking help from you with services that they need, both imminently at this time and looking into the future. And it's there where the partnership with LA County Department of Mental Health providers, I think, is going to be really useful, in that you will have a warm handoff. I think that's the phrase that Isaac used last week. A warm handoff to a certified mental health provider that has expertise that will be able to help you help the people that are seeking help from you, right? That will help them to navigate the pretty complex web of services that are offered through the county, that will help you to identify other types of interventions, other tools that you can use to help the people that are coming to you for assistance. So you can see there these 8 principal actions or structured actions that form the core of psychological first aid: contact and engage, providing safety and comfort, stabilization, gathering of information, giving practical assistance, connecting with sources of support, discussing actionable coping strategies, and then linkage to other services. As a first responder, when you find someone bleeding out in the street, you don't clear everything away and set up the operating table, right? That's not the role of a first responder. The role of a first responder is to help bring some calm, some stability, assess the situation, respond with the most imminent needs, and then link to what comes next. All right. So having had this overview, I'm going to take a quick look at the chat and see if there's any questions or any comments that people have at this stage, and then we'll go into each of these core actions one at a time to flesh them out a little bit more. Viveka Hasbone, I'm not sure if I'm pronouncing that correct, but Viveka says, even negative alliance can be interpreted as a basis for trust and courage to engage people further. So I'm not quite sure what you mean by negative alliance, Vivica, but
Well, sometimes, patients that we work with go into a negative transference relationship where they don't trust, they complain, they want to change provider, and they're unhappy. And we can use that and turn it around, tell them that they must trust us a lot to be able to tell us all this, and even encourage it and show them that it takes a lot of courage to do that. And I think it's really very important for the therapeutic alliance, for the engaging them, for allowing them to vent even negative thoughts and not take it personally and not be offended by it, etc. I mean, to a point, until they start threatening or something, we have to be vigilant and make sure we're safe. But I remember one time I was in the ER working, and some sheriffs came in and they said, there's a guy hanging in the top of the parking lot. Is anybody interested in going to speak with him? And I said, yes, I will. And I went, and he was on the other side of a barbed wire thing, and I was on this side, and he was only Chinese Mandarin speaking, I think, and I don't know any Mandarin. I couldn't figure out how to engage him. And then I opened my phone and I showed him children of my pictures of my grandkids. And I started to point to them and tell him that they are my grandkids, using sign language and all kinds of things. And then he had a tear in his eye, and he sort of implied that he also has grandkids. And I kept him engaged in this conversation with pictures of my grandkids. Mm-hmm. The fire department came and got him, and we got him down and so forth. So
that story,
be resourceful. And I was, I don't know what I would have done before iPhones, but at that point I had one and it worked. So
that story illustrates the power of being able to connect with someone as a human being.
Yeah. And to find be resourceful.
That's right. To find a point of common ground. Yeah, to find a point of common ground with the person, and to engage and to be creative and to be flexible. But you were able to build that sense of trust, find some common ground with this gentleman that allowed you to get him to the help that he needed. So thank you for that, Vivica. Dale Scheckler here is asking, how do you apply these steps to someone that is already mentally ill? I would say, it really is about meeting people where they are. People with mental illness are people first. Yeah, human beings, children of God. I remember when I was a kid, I had an experience where I went into a treatment facility with people that were severely impaired, that had severe mental problems. And there was a priest there. I later realized he was a priest, and he said to me, always remember that every person that you come across is a temple of the Holy Spirit. We're people first, and connecting on that level with someone, just letting them know that we're all connected. There's that beautiful song, we're one body in Christ, and we do not stand alone. Letting someone know that they do not stand alone, that they're not facing whatever it is that they're facing alone. People with mental illnesses are people first. And we can all relate on that humanistic level. And so I'd say that's the place to start. And that's number one, contact and engage. Sort of, even if someone looks incredibly distressed and you can tell that something is, quote, wrong with them, connecting with them on a humanistic level. First is that first step of contact and engage with compassion, with unconditional positive regard for them. Okay. Keep the questions coming. Yeah, I will continue to keep a look on the chat. Yes,
and just for everyone's reference, we are going to make the PowerPoint and toolkit available after the presentation via email, so you'll be able to reference that, both this PowerPoint and the previous one from last week. So in case you missed any of it, that will all be made available to you.
Yes. So contact and engage. First step, introduce yourself, who you are, where you're coming from, what your role is in the ministry. Get the person's name. You know, there's tremendous power in calling someone by name. That in and of itself can be orienting, can help to ground a person that is in a state of crisis. So when you share your name and they share their name with you, let's say that the person's name is Mary Robinson. Integrating Mary's name into everything that you say. Mary, I'm so glad that you're here with me. I'd like to speak with you a little bit about what it is that's troubling you. First of all, Mary, I want to ask your permission to ask you some personal questions, right? Using the person's name, repeating the person's name in and of itself. It seems incredibly simple, but there's great power in a person's name. It's orienting. It can begin to build that sense of trust and relationship. Asking about their immediate needs and discussing the limits of privacy and confidentiality. Some of you are operating in different contexts. Some of you are mandated reporters for various different reasons. I think it's important to have those conversations early on with someone. And if you are a mandated reporter, letting them know what the limitations are of the privacy that you will be able to keep with them. For priests, this came up in our training yesterday in Spanish. You know, making a distinction when someone is coming to you for confession, making sure that the person understands. I know that our priests understand, but making sure the person understands what is under the confession, the seal of confession, and what is not, right? And being very explicit about it. Understanding from the person if they want one-on-one help. Some people are going to want one-on-one help. They don't want you to talk to anybody else. They just want to talk with you. Other people are going to come to you and are going to want assistance in speaking to a spouse or to other family members or to other people that they're related to. So understanding the frame of reference of the person who's approaching you for help is important. And navigating upfront what the sort of privacy parameters are and what the expectations of the person are regarding their privacy and confidentiality and what you're able to provide to them. You want to understand right off of the bat whether the person has any health-related issues that require immediate attention, right? Have they been out of insulin for a few days and they're diabetic, right? That may be at the forefront and they don't feel safe and they're coming to you in a moment of crisis and emergency, right? Might there be some other reason why they don't feel safe? Maybe they're in a home where domestic violence is present. Maybe they are in a situation where they're fearful for their own safety and life because they don't have a sense of security in their immediate surroundings. You want to, in providing that sense of safety, understand when does the person feel safe and when do they not feel safe? What are the most imminent threats to their personal safety? As Dr. Partida mentioned, we have a real spike in the amount of people that are having suicidal thoughts and are acting on them throughout the county. It's important to be able to approach these topics without fear and allow people the space to be able to voice some of these thoughts, right? And then if you feel the person is in imminent harm and needs help, seeking out help. And that's where your partners at DMH are going to help you so that you're not in this all by yourself and don't find yourself in a situation where you feel like you're in over your head. There's so much grief. And unfortunately, I think that's only going to continue in terms of the loss associated with COVID, associated with the drivers of racism in our society right now. Sometimes providing a sense of safety and comfort is about creating the space for a person to openly grieve, to share with you what they have lost, who they have lost, whether it be a job, whether it be a loved one, a relationship. And so creating that space where a person feels safe, that they can bare their heart to you in that moment You may want to start, how do you create that? For some people, they pray together at the beginning. That may be what the person needs. A sense of spiritual communion in that moment to be able to grieve, right? And you want to understand, specific to COVID-19, specific to all of the demonstrations and protests right now about the suffering of people of color, you want to allow them to speak about it, to share their own feelings. You want to understand where they're getting their information, maybe about COVID. Maybe they don't really understand what it is. There's a lot of misinformation out in our communities right now. And so being sensitive to that, making sure that the person isn't just upset because they don't understand what it is that's going on. We have a couple comments in the chat here. Take care of body language as well and gestures. That's right. If you see something in a person's body language, don't assume that you understand what it is. Use what we call a process comment, where you would say, you seem to be really tense. Your body language, from my perspective, looks like you're really upset, or like you're holding something in. Opening the door for communication can be really, really a powerful thing for someone to give them permission to open up that floodgate. We have Sister Elizabeth Miles. She says, do you have some tips on what not to do when a person has had a loved one die and the family was not able to be with him or her? A woman once shared with me her feelings of anger when, after the death of her father, this was not COVID related, a religious sister had said, "Now your father is in a better place." I remember the look in her eyes when she said I could have slapped her. I know that sister meant well, but the woman was very offended. Do you agree that when people are going through such situations, usually the best thing to do is listen and not say too much? Well, Sister Elizabeth, I think there's tremendous wisdom at the end of your thought there. There is wisdom in listening more than you speak. And that if you speak, it be to facilitate the other person speaking. And really focus more on being with the person, sort of accompanying them, lending them support unconditionally. And it may be that what they're saying makes you feel incredibly uncomfortable, but that's okay. Just sit with them and allow them to express themselves. That being listened to in and of itself, being able to provide a space where the person can speak and express themselves, that in and of itself will help the person to feel better and give them a greater sense of safety, that they can say things maybe that they don't feel that they could say to anyone else, that they're afraid, that they're angry, that they're hurt, that they're even disgusted, or other more inflammatory language. Just giving the person an ability to just know that you're there with them. Yes, Sister Elizabeth, like Mary at the foot of the cross, just to be present for that person, and to know that neither of you is alone in the moment, but that God is there with you, and open your heart and just listen. And I think as you practice this a bit more, and it may be thrust upon you before you're ready, just trust that this framework will help you to organize what it is that you do to help the person through the crisis, and to move them on to what is next. Safety and comfort, helping the person see that, okay, if you don't feel safe, if you're not comfortable right now, what's the next immediate step that we can take to ensure your well-being? What is currently being done? What have they tried that isn't working, right? With the focus on safety, connecting them to other people that may help with that safety. Again, if the person is on the street, maybe this is where you will stop and say, let's work on getting you a place where you can at least stay for the night. And working with your DMH partners, or working with the resources that are available through the Archdiocese. Bringing up-to-date information. Sometimes people will not feel safe because they have misinformation, And so making sure the person has up-to-date information on COVID-19 and what is plaguing us right now will be really important. And the DMH can provide you with good, up-to-date information to supplement what you're already getting provided by the Archdiocese. Even just normalizing for someone what common reactions to stress are. That not being able to sleep, that feeling anxious and shaky, or having palpitations, or feeling shortness of breath, or sweating profusely, or all these somatic physical manifestations of stress can be very normal, right? So helping people understand what common reactions to stress are. Talking about not only their own self-care, but again, that unit of analysis of what are they coming for help with? Is it just them, or is it for the whole family? Because what may make that individual feel better is when the people around them feel better. And so being open to addressing the needs that that particular person is bringing before you. What is a threat to that person's safety or to their sense of safety for their family? That may be very, very different from different people. You know, helping others sometimes is therapeutic in and of itself. Let me explain what I mean by that. You know, sometimes when people are incredibly anguished and overwhelmed and in crisis, it's in giving of themselves to others that they start to feel better. Is that the paradoxical nature maybe of what St. Francis says? Yes, it is better to give than to receive. Sometimes connecting people with an opportunity to serve others is all they need. It helps them to reevaluate their own experience in light of the experience of others. And they return that sense of self-efficacy and contribution, yes, by engaging in charitable, loving acts, works of corporal mercy with others. And if right now, because of social distancing, a lot of those are problematic, well, then they can focus on some spiritual works of mercy. But getting them outside of themselves to reconnect in the process of giving and supporting others is a huge intervention. There's a question here that we haven't read, you know, is anyone using this crisis, and any of you out there using this crisis to help others? In what ways? You know, how do you feel that you're able to address the crisis so far? How is your own particular context of ministry? How does it interface with the framework that we're talking about here? Maybe you've already engaged in some of these activities. Maybe you have other ideas, and that's good. But hopefully you can begin to connect the content of what we're talking about here with the local sort of incarnation of that in your everyday experience. Reliable sources of information are so important, as we talked about before, dispelling rumors and myths, making sure that people understand sort of with a high degree of fidelity what the risks are, connecting them with sources of information that they can trust. And this can be controversial because people have all kinds of different political views. This is not political. This is about well-being and about identifying whether the sources of information that someone is connected to are doing them good or are doing them harm. And that's going to be very, very individual and manifest differently in different people. But simply having a brief conversation about, you know, what are your sources of information, and are they helping or hindering your mental sense of well-being? Number 3, stabilization. Stabilizing thoughts and feelings. You know, we're talking about this so far as if we're talking to adults, yes, but this crisis is also affecting children. And children rarely will be able to tell you exactly how they feel in a real articulate way, depending on their developmental level or how verbal they happen to be or how upset they are. Sometimes it's easier to identify how you feel by pointing at a face. Right? Sometimes it's easier for adults too. I kind of feel like that, you know, maybe, you know, which row, maybe 1, 2, 3, 4th row, second from the left, I'm feeling a little quirky today. Or, you know, identifying how do I feel in this particular moment. when working with children with different developmental ages, you've got to be creative. And sometimes it will be parents coming to you and saying, I don't know how my child, how can I help them find some sense of calm? And you can share ideas like this about helping people to begin to open up and talk about their feelings. Emotional reactions are incredibly varied across people, across contexts. I had a priest tell me about showing up at a funeral home, and there were hundreds of people outside. It was a Latino family, hundreds of people outside waiting to go in for the funeral, and they were told, they made this big announcement just as the priest was getting there, only 10 people will be allowed in. And the priest says to me, some people started sobbing, some people started yelling, others were complaining, others were banging up against the door of the establishment, beating their chest. How can this be? You know, people responded in all kinds of different, some people got in the car and sped off. Other people just sat on the ground dejected and couldn't even hold themselves together to stay standing or to respond. People respond in lots of different ways. And you have to be open. You don't know how a person is going to respond to you. And so again, if you can accompany them, if you can create the space where that allows them to respond however they need to respond, to release some of what they've been carrying, that can be really powerful, and it can get them to a place where they can breathe again and be a bit more stabilized. Behavioral changes, adaptations to stress can manifest in maladaptive ways by turning to substances, right? Drinking alcohol, smokers saying, I'd gotten down to half a pack and now I'm up to 2 packs again. I can't help it, I'm stressed. People are eating more, some people are eating less. Some people are sleeping more, hypersomnia, they're just tired all the time, sleeping all the time, they don't want to deal with anything. Other people can't sleep and are dealing with insomnia. All of these ways in which we cope, some of which are adaptive, some of which are maladaptive, increase the risk. If we're in a heightened state, they increase the risk for things like domestic violence, like child abuse, elder abuse. And in fact, that's what we're seeing a lot of right now throughout the county. And so giving people an opportunity to share maybe their own fears that they may be getting close to some maladaptive ways of coping. It's important to acknowledge that there's great diversity in the ways that people will react to stress. There's individual stress and there's communal stress, right? Sometimes whole families will kind of feed off of each other and the degree of stress. And so a person may be coming to you for, again, an individual need, how they themselves are feeling, or how they feel their whole family is feeling. It's normal to develop emotional reactions to stress. A lot of times, these can manifest as anxiety, as depression. There's a lot of uncertainty, fear, loss, grief, guilt for not being able to help certain people, for not being able to travel across the country to take care of one's older parents, or there's lots of different reasons. There's a lot of grief and there's a lot of guilt. And so being able to help people to accept, at least temporarily, the way things are, to acknowledge, if not to accept, to speak it, to name it, the loss of their sense of security, the loss of their health or that of a loved one, of connections with other people, of a job, of a loved one's life. It's important for people to have the experience of being able to open up and just share what it is that they're experiencing. That in and of itself, if you can hold that in a non-judgmental, supportive way, that will do wonders for the person. So the question here, have any of you experienced so far one of these feelings as a cause of the coronavirus? Either in yourself, or have you observed it in someone else? Again, I encourage you to connect the content to your experience and see, how will I be able to weave this in to what I do in my particular ministry? Children, you know, it's important that we talk about kids, can become more aggressive, more difficult to manage. They also are experiencing this crisis. Children are also having emotional reactions and have even less experience with their emotions because they're younger, right? And so how, you know, I've had parents say to me, gosh, you know, my 10-year-old is acting like he's 5, sort of regressing back. Children always are not able to verbalize how they feel. Some adults have a hard time doing that too. But being kind and compassionate and helping people to say, you know, if the behavior's changing, something, if things are changing on the outside, something's probably changing on the inside too. And so how do we draw out what is going on the inside? I give the example with children of a child who internalized a sort of causal explanation for why everything that is happening in our world is happening right now. This child that came to the parents and was just sobbing. I broke a plate and I hit it and you didn't know, and all of a sudden all of this started, right? Kids will try to make sense within their own sphere of understanding of what is going on. And unless we draw it out and have access to what's going on in their minds and their hearts, there's very little that we can do about it. And so trying to elicit a child's understanding of what is happening and creating the space where they feel supported and that they can be listened to is very important. The sharing of feelings in general, as we've been talking, is incredibly important. And you may be the person that has the skill set, the patience, the know-how to create a safe space where people can be calm speaking about feelings. Because in other contexts, in some families, in some work environments, you start talking about your feelings, it doesn't stay calm. It isn't necessarily supportive. People react to people reacting about their feelings. So being able to hold that with the people that are seeking help from you will be critically important. Here's some important sort of things to keep in mind when speaking with kids in particular. You want to communicate or model for people the communication of speaking to kids as things are happening, you know, and giving them those messages of hope and security. Telling them stories about how, you know, as a community, as a human race, as a religious community, we have faced disease, plague, persecution, wars, all kinds of things in the past, and here we are. You know, that reconnecting and sharing stories of that faith journey, and that ultimately we are together and we do not walk alone is important for kids to hear, right? So that they can maintain a sense of hope, and they can then share their own feelings of fear and maybe their own explanatory models or beliefs about what is increasing that fear or increasing that pain that they might be experiencing on the inside. So again, you see the red questions here, inviting you to reflect. Have you, what kinds of experiences have you had interacting with kids or talking to people about children and how they're dealing with all of this stress? It's sometimes overwhelming to think that this is just the halfway point of a psychological first aid. It's like, well, we could spend all our time on those first 3 moments, right? On those first 3 core actions. And it may be that you don't get all the way through all 8 core actions, but you want to try to keep the momentum moving so that you can reach stage number 4, where you actually gather information after they have let all of this out. And now they have an opportunity to reflect upon, right? What are their current needs, their most pressing proximal needs and concerns? For some, you can see examples here. For some, it may be the separation from others. For some, it may be physical illness, either that is already present or that is feared. For some, it may be an immediate danger or threat to their safety and well-being. For others, it may be that seeing themselves fall into bad habits and maladaptive ways of coping again. For some, it may be at an individual level. For some, it may be at a communal level of the family. But you want to understand as you gather information, what is it with this specific person? Because this is not one size fits all. We're all so different. What do you do after gathering the information? You know, how do you want to try to see if you can tailor, you know, a hierarchy of what are the most important things for this particular person, a hierarchy of needs, yes, organizing it, maybe just putting it on paper, helping the person to organize their thoughts and to say, okay, what's the easiest one of these that we can begin to address together? And then developing a specific plan for specific needs and an order of priority. And start with the simplest stuff first so that the person begins to feel, again, a return of self-efficacy and agency. Number 5, after we've collected and organized sort of a plan of action, practical assistance. Identify the most immediate needs, clarify how often it's happening, and develop that action plan and start working with the person. Maybe there are things that you can address in that very moment with the person. We have a couple of things coming up on the group chat. Lisa Schaefer says, what is a good intro question to start that share your feelings conversation with teens? You know, I think self-disclosure can be really a powerful way to break the ice and to say, you know, I'm either disclosing of your own experience in a way that, you know, demonstrates that you can relate, or saying, you know, I've been working with teens for a few years now, and these are some of the things that usually come up. Have you experienced any of these things? You know, or it's usually hard for people to talk about their feelings. I've had a hard time identifying my own feelings, and this has helped me in the past, right? I think if you spent the time to try to build that rapport, to connect on something, you know, the lady talked about connecting with pictures of grandchildren. With the teen, you got to be creative and see what do you have in common, right? It may be just reflecting on, gosh, you know, I wasn't as old as I am now, if you can believe it. I didn't always have this gray beard, you know, when I was your age, X, Y, and Z. There's lots of different ways, but I think you want to find a point of commonality and build off from there. Lauren is asking, how can you as a practitioner pace the sessions so that you do take time to complete steps 1 through 3 before getting to number 4 and beyond? For example, what if someone just wants to connect to resources but isn't interested in sharing specifically what they need or their thoughts or feelings? How is readiness to receive the information or readiness to share factored into this framework? That's a wonderful question, Lauren. You know, I think you want to try and move your way through, and you're going to have to feel it out and see if you feel like you have that rapport with the person, then maybe you don't spend as much time on one, right? If the person isn't feeling a particular threat to their safety, they feel safe, they just want some practical advice, but you go through it just to make sure so you don't miss anything, right? If you're going to be able to tell whether they look stable, that's going to give you some clues. But there are times when a person can look very, very stable. And unless you ask and you query that stability and you ask, how's it going on inside? People are really good at hiding things and holding things in. So I would say the pacing of going through the different actions will vary on the person. And you're going to have to use your own clinical judgment, or your own intuition. Ask the Holy Spirit to guide you in the moment, yes? And again, you're acting out of good faith. There is no short and fast rule here. With some people, you'll spend the bulk of your time on the front end. With others, like you said, maybe they'll be ready. Maybe they're not challenged by issues of safety. Maybe they trust you right away. Maybe they are calm in the moment and just really need someone to brainstorm with. Then you'll get there, but try to go through the steps, even if you go through them quickly. That would be my short answer. But thank you. That's a great point. Okay. Positive thinking, right? In giving practical assistance, positive thinking. Helping to reconnect. When someone is in crisis, we tend to see the negative in things. We tend to catastrophize and project to the future. So providing someone with some positive thinking, right, is important at this stage as you begin to intervene. Sort of, if you're good with humor, humor can be a great tool, but it can also be a disaster. So you have to be careful with humor. And you kind of have to use your intuition and see how it's going with the person. Bringing faith into it, bringing Jesus into the moment, yes. Inviting God into that space to be able to adopt a more positive frame. You know, the purpose of this is trying to begin to shift and make sure that the person is oriented within a positive framework, with a positive way of looking at or perceiving, attitudinally facing in a positive direction. For some people, and this sort of speaks to Lauren and how you're going to have different folks, different strokes with different folks, yes? It's less about addressing specific problems and more about reconnecting a person's mind and focusing them on constructive and creative activities. People talk about the 7 deadly sins and the 7 cardinal virtues, yes? And that if you focus on the virtues, you don't have to worry as much about, responding to the sins. People talk about the balance between positive and negative approaches to dealing with problems. So helping people to engage in the practice of virtue, in the practice of constructive and creative activities can be enough to help them to weather any particular crisis. Finding a book that the person has been wanting to read, taking an opportunity. Hey, I'm home and I have all this time. I might as well sort of adopt a retreat sort of framework for myself, that I'm withdrawing from the world to get right with God, to get right with the people that I'm closest to. Getting into some sort of an artistic practice or craft or music or something that helping them to identify something they've always wanted to do but never had the time to do. Maybe now they have the time. There are lots of other ideas and things that can become the focus of constructive and creative activities that are less problem focused and more about engaging the person's mind and will in things that are going to help them to weather the crisis. Cooking, new recipes, grandma's old recipe. Yesterday we were doing this in Spanish and we talked about if we can get all the ingredients, could we make mole at home? Being creative and thinking about, maybe some family prayer time, praying the rosary together, thinking about ways in which, playing board games together, doing things that connect people and engage them in positive ways with each other at a local level. Basically avoiding boredom and lack of activity. Some people, as long as they're engaged in something positive, they're going to be okay. You don't know the type of person that's going to be sitting in front of you, whether they need help with specific problems or whether they need to re-engage with life in new and positive ways. So you want to be flexible and realize that in some cases, it's about reconnecting people with positive activities. Structure and routine. The last time we talked about the disruption that COVID-19 has created in our everyday life routines, in our sleep, in the way that we do things, in our commute to and from work, or etc. And so this is structure and routine is really important, I think, for everyone, but for children in particular. Predictability, knowing what comes next. Those of us that are teachers really understand this well. And when we understand it, it can be used to really structure the day with a whole room full of kids, right? Structure and routine, knowing what comes next, predictability, that decreases uncertainty, right? It helps people to get on the same rhythm and wavelength with each other within the home. A schedule for eating, and then that makes room for true spontaneity, right? If you have the structure and the routine, then you can enjoy the spontaneous moments, the gifts, those moments of grace where things just are good. Sister Elizabeth has another comment for us here in the chat. Says, by the grace of God, I have been able to see how God is bringing good in many ways from all that is going on. I catch myself holding back on sharing too much of those experiences because I feel that the person who is suffering may feel that I am not acknowledging their feelings. Can you be too positive when helping others? I think that if you're aligning with the person, you'll be able to tell. And if you share empathy, it can be incredibly powerful to help someone to say, I realize you're dealing with all this grief and loss. I realize that you feel guilty in this moment. That must be so hard. Can you contemplate the possibility or can you see something in your life that you still feel grateful for? I think if you're effusively positive as people are dying around us, that could backfire, as you're saying, sister. But if that doesn't mean that you shouldn't be who you are and bear witness to who you are to the person. Because in the same way that we want them to be who they are with us, we need to be who we are with them too. We need to carry on that message of optimism and hope. You can't hide your own light under a bushel, right? So that balance, though, and that balance, but you have to trust your intuition, your sense of how you're relating with the person. That's why I said earlier that humor can be a tremendous ally in this, but it's got to be well timed, or it could be catastrophic, right? Okay, connecting with social support, well-being, and emotional recovery. So this is hard because we are so separated. We're socially distanced. Yes, that's an unfortunate term, as has been commented on the news and elsewhere. Why couldn't we talk about spatial distancing rather than social distancing? The fact of the matter is that we are socially distanced in the ways that we're typically used to engaging with each other. So helping people to find new ways. I think I may have given the example last week of my wife teaching the older women in our parish how to use Zoom and how to use Facebook to be able to pray the rosary together, or to come together to have a little coffee. And you've got all these, septuagenarian, like 70, 80-year-old women, all of a sudden sitting in front of a computer, praying their rosaries, putting their little votive candles in view and holy pictures, and really connecting that way. And then sticking around and having a little bit of coffee and some social engagement in this other way. And all of a sudden, these older women are now understanding their grandkids and the younger people a little bit better, because they're learning how to engage via social media. Sometimes it's just about teaching someone that there are other ways. To Sister Elizabeth's point earlier, this is a time ripe for reconciliation, because there are people that we have been socially distanced from, but the reasons why we became socially distanced from them have nothing to do with COVID or nothing to do with any of the other challenges in our society right now, and everything to do with interpersonal rifts and hurts and a need for reconciliation. So one of the powerful ways to connect people socially again is to invite them to pursue acts of reconciliation. Reaching out. It's like, well, how do you, maybe it's picking up the phone. Maybe that's what you would have done anyways, but you weren't doing it before. You pick up the phone and you re-engage with those that you have had a rupture with. Connecting in safe ways, volunteering, time. Phone banks are a wonderful thing, especially for older parishioners in church. They don't get too many phone calls. Organizing at that level to where you have like a phone bank on Saturdays or on a certain day. Some people live for those phone calls. That is their social outlet. Again, getting out of oneself and realizing it's not just about my own social needs, but but the needs of others. And when we reach out to others, guess what happens? Social connection. You're going to get these slides. You're going to get a bunch of resources that are going to be available to you about how to talk about COVID in developmentally appropriate ways with kids, with adolescents, with young adults, with older adults, etc. And it's important in that social engagement that we do so in a way that is appropriate for the different developmental levels. Number 7 is usually what people think about when they think about, psychological first aid. I would say this is number 7 is sort of the skills for psychological recovery preview, because they are the more specific skills, the coping strategies. And you're going to have an opportunity, again, we're going to give you a field manual, a PFA field manual that was designed for communities, faith-based communities, when it was put together. And there's going to be lots of pamphlets and resources in there that will guide you, that you'll be able to look sort of at a menu of options. How do you provide basic information on ways to handle adversity? How do you talk to children about their physical and emotional reactions? How do you assist someone that is, constantly thinking about negative emotions and is feeling depressed? What types of recommendations are out there for someone that has sleep problems? These are the specific coping strategies. Notice that they come at the end. If there are leftovers, because a lot of the big stuff, a lot of what is really causing anguish and pain in people during a moment of crisis is deeper than the specific symptom to intervention strategy link. Right? Some people get to this point and it's just sort of putting the icing on the cake. For others, to the comment that came earlier, this is what the person is really looking for. I need help. I haven't slept for 6 weeks, right? Or I've got anger management issues. Can you help me with my temper? Right? Very skill-based. And so this is the discussion of specific coping strategies. With kids, here are some general principles for talking with children. You want to stay calm, convey calm. They work with adults too. Again, be predisposed to listen rather than to speak. I think a good ratio is 70% listening and 30% speaking. Right? You want to overcorrect and listen a whole lot more. That's what people need in times of crisis. We think that, what they need is a word that's gonna make it all better. Well, maybe that word is Jesus, but it isn't anything that I can say, right? And so listen to what people have to say. Avoid using terms that could make someone feel like as they're being blamed or that promote stigma. Pay attention to what kids are watching on TV, what they're listening to on the radio, what they're reading in a newspaper that might be around. The same for older adults or adults or adolescents. Pay attention to the streams of information. Finding the right balance between not enough information and like information overload is if I could solve that one, I would be rich and famous, okay? And so you're gonna have to find that balance with that particular person of how much information is too much information and how much is not enough. Provide information that is correct and accurate. The Archdiocese has done a wonderful job, I think, of getting information out to people. We want to be able to supplement that as well through the Department of Mental Health by making sure that the information that you give is accurate, correct, and is actually going to help people and be positive in the person's life. And with kids specifically, real concrete steps, teaching a kid how to wash their hands the right way, right? You see kids, happy birthday to me, happy birthday to me. Some kids, parents are like, okay, you got to say a full Our Father and maybe a Hail Mary, depending on how quickly you go through the prayer, and all of a sudden the child is sort of learning more things and practicing certain things and having good, positive things in their mind as they are taking care of themselves and taking care of their family. Physical exercise is a wonderful thing, right? Exercise creates endorphins in our bodies. It creates positive chemicals that make us feel better. They help us to feel better. But exercise isn't just about going to the gym. You know, we've kind of bought into this idea that, oh, if I'm going to exercise, I have to go somewhere with a special machine or something. You can dance with the family at home. You can chase each other around and be a little goofy. Get moving. That's the take-home message. And get moving in ways in which you engage with each other. You kill two birds with one stone. You've got some social contact and engagement. You're going to get various different examples of ideas that parents can use for activities with their kids. I find that this is one of those areas where parents really want, like I've been home with my children constantly for months now. Please give me some new ideas. I'm running out of tricks to use. And so you're going to see various strategies here. Calming activities, again, it could be mindfulness, it could be deep breathing, meditation, it could be quiet prayer, it could be spiritual reading, it could be anything that helps to ground the person, that promotes calm, that promotes relaxation. There's some breathing exercises, some relaxation techniques that you'll see, an example for adults and an example for kids. The relaxation techniques for children, I like, you have kids lie on their back and maybe put something on their belly and watch the belly go up and down as you take a deep breath and as you exhale. And it helps the child to learn to regulate their emotions, to self-soothe, which can be really, really hard when you're in a state of crisis and when there's a lot of chaos around you. Developing these types of practices, connecting them with people's everyday lives. There's simple interventions that pay huge dividends. If some people say, the one thing that changed my life is I learned how to breathe. I was breathing all the time, but not really intentionally. And now that I'm aware of my breath, I feel better a lot more of the time. We've talked about the danger of unhealthy coping strategies or unhealthy habits. I think it's important in this section, in section number 7, to talk about that, to put it front and center, to see if that's at play in the person's life, or if they're at risk for falling back on certain maladaptive coping strategies, bad habits, right? Because we want to avoid things from escalating. I wish I could say this is going to be over soon, right, in terms of this pandemic, but I think people have said, oh, it's not a sprint, it's a marathon. I've gotten to the point where I'm saying, you know what? It's a whole Olympic Games, right? It's not just a marathon. They're different events, and they're going to be strewn out over time, and it's a whole Olympic Games. The final link, and we're reaching the end here. I know we've had questions as we go along, but get ready if you have questions for the end. I'm happy to stay a little bit after 5 if you'd like. Is the linkage to helpful services. The linkage to allied services. And here really is the value of not just providing you with a framework and an educational talk like this, but really making an invitation to partner with professional mental health providers at your local parish levels, at your local school levels, Catholic Charities levels, whatever ministry it is that you're involved in, that that you have linkage with the broader county services and someone that will help you to navigate those services so that you can connect a person with exactly what they need. And so, as I said from the beginning, about 70% of people are going to respond really, really well to the psychological first aid, to 1 through 7. Some may respond to the combination of all 7. Some may respond only to a few of those items. But those 7 steps, about 70% of people are going to respond favorably. They're going to be able to get through the crisis. Do in the recovery phase. Right now, it's about first responder crisis. It's number 8 that I think is really important for that 25 to 30%. That even after you engage with them, even if you do everything, quote, right in the first 7 steps, they're still going to need additional support. And we want to provide that direct conduit, that warm handoff, to use Isaac's term, to the mental health professionals that can help you with that. And those same mental health professionals are also going to be available to consult with you to be able to build maybe a mental health awareness program. That came up in one, I think the past meeting. You know, what would it take to create a mental health awareness program within my parish? Well, here's a vehicle for being able to do that through these linkage services, through this opportunity to consult, and also to inform the practice of mental health from your Catholic perspective, which I think is really, really valuable and important at a broader level. Just briefly, because we're running out of time and I've alluded to the recovery phase. Skills for psychological recovery will come later, after the crisis. Right now, we're dealing with the crisis, right? First responder. Skills for psychological recovery, we can have a training in the future about more specific skills that can be deployed, right? And how do you do that? This modality is one that can be used at the parish level, at a community level, 1 to 5 visits, but it's much more specific in helping someone to truly recover and reintegrate with society. There are 6 core psychological skills for recovery, or skills for psychological recovery. Notice that what used to be number 4 now becomes number 1, gathering information and prioritizing assistance. And then we go into building problem-solving skills, promoting positive activities, managing stressful reactions, promoting, techniques for promoting helpful thinking, and then rebuilding healthy connections with all of those intermediary skills being taken into account. It's sort of the advanced class, or if PFA is 101, this is the next class, right? And how do we help people to recover effectively and to build skills that will keep their mental health optimal, their sense of well-being high in the midst of life's challenges, but not in a moment of crisis. That's what PFA is for. Okay, you're going to see there's a guide to some resources on here. Again, you're all going to have access to these slides and to a resource packet. The county really provides a whole host of services, housing, food insecurity, mental health, as well as health services, financial resources, assistance, with special needs. All of that is available, and we want you to have access to that. Here's some resources from the Department of Mental Health. There's an access line that you can call, but each of your parishes, each of your organizations, if you choose to participate in this partnership, will have a mental health provider, whether it be a psychologist, a licensed clinical social worker, a marriage and family therapist, some allied mental health specialist, psychiatrist, will be connected with your particular faith-based organization.
And if I can chime in for a second here, Doctor, I think that honestly the value in having somebody to be able to speak with directly, that again, that warm handoff, is so vital and so important for something like this, because I think, especially working in ministry, we've all had those situations where we were given a resource phone number, we call, and inevitably it'll show up in some voicemail box, or we have to send an email, and it takes time to hear back from someone. So the fact that we have this as a resource is a tremendous value.
Yeah. And so in closing, we're just about 5 o'clock. We took questions as we went along, but I will stay to take more questions or comments if people have questions or comments, or if you have feedback regarding, how this connects to your particular organization, what next steps you would like. We're happy to take all of that. But what I will say, sort of coming round circle, is that the most important part at this point is, now that you've been exposed to this content, to this methodology, if you will, to this framework for being able to help someone in a state of crisis, this psychological first aid, spending a little bit of time continuing to think through, how does this all connect with my specific context, with the people that I work with and come into contact with in my community, with those that maybe I haven't been able to connect with, but that I know need me. And really make this content your own by allowing it to take hold within the workings of your specific community. Okay. Ann Sanders says, thank you so much, Dr. Cajigas. Thank you to all of you for your attention. We're right at the 5 o'clock hour. You can feel free to go if you need to go. I understand people get zoomed out and have other commitments, but if you'd like to stay and ask questions, I'm happy to take them. Thank you so much. And you can use the chat, or if you'd like to, you can also unmute your microphones and we can do it that way. Isaac will help me to manage all the technical pieces here.
Absolutely. And remember, we will be sending these resources out in an email, and we'll also have an opt-in feature for everyone to be able to accept the resources that we want to make available to everybody. So expect to see that in your inboxes soon.
Okay. So it says here, since this is a partnership effort in LA County, do you have connections or leads that could work for Ventura or Santa Barbara County, which are also portions of the Archdiocese?
Yeah.
At this point, this is an effort within LA County, but I will follow up on this for you with my colleagues at the county, at DMH, and see if we can't build a bridge to some of the other county organizations.
And I can tell you from our office, we have been in touch with Santa Barbara and Ventura County, mostly for the sake of the COVID virus and reporting our cases that we've had. But again, we will make sure to link back with Doctor and see if there's a direct connection that we can make for similar resources in those areas.
Okay, I see we have Rosemary Villanueva that is kindly raising her hand. Rosemary, I will give you the virtual hand. I will give you the floor to go ahead and take the mic.
Well, that was going to be my question. Like, how does the like, for example, if I'm a volunteer with the parish in Avadio in Oxnard, California, in Ventura County, what steps does the parish, the pastor or the principal of the school need to do in order to be able to make that connection that you're talking about at the parish level? When you said, each parish will make a choice about whether or not they will partnership with, with a department or with, in this framework in the Archdiocese. How do you all have some protocol or steps that the pastor or whoever can take, or what they have to do in order to create, for example, a position or whatever for the parish for a mental health person?
So I know that LA County is very interested in partnering with the Archdiocese broadly, and I think the issue that is getting raised right now is an important one. When you build a program that is responsive to the needs of your constituents, there are always things that come about that maybe haven't been completely thought through. And I think how we do that outside of LA County is one of those things. So what I can say are two things. One, I think as we continue to offer trainings and opportunities for learning, participation is open to anyone in the Archdiocese of Los Angeles. As we go forward in terms of the linkage services, as I said before, I will contact my colleagues at LA County Department of Mental Health and see if we can find a way either remotely or find some partners in the different counties that some of the parishes of the Archdiocese belong to.
Okay, because I'm, as a novice, I'm just, a lay person.
Mm-hmm.
I'm under the assumption that those things are already done, are being done, or they have been done. And if I go, for example, to my pastor and I say, well, Father, you can call up so-and-so. And then if he calls up and there's like, that hasn't been worked out yet.
Right.
So I'm just curious if there will be something like that available for, the ones that make the decisions at the parish level.
If you ever have any doubts, you can always contact the Office of Life, Justice, and Peace. And if we don't have somebody to if we don't have somebody that we can send you to directly, we'll make sure to help you find a resource. Absolutely.
Okay.
Okay.
So it's the Office of Life,
Justice and Peace at the
and
Archdiocese. And you
Peace.
can ask
Okay,
for myself, Isaac, or Lily as well.
I see.
Lily Alvarez. Isaac Cuevas
Oh,
or Lily
okay.
Alvarez.
Okay, all right. Thank you so much. I appreciate
Happy to
that
help.
because I want to share that with people there. Okay, thank you.
So there's a question here from Eva Fukumoto. How much information of the COVID-19 do DMH staff need to know in order to do this role well? We're not medical staff. We do not want to do things that are out of our scope of practice. So the emphasis of this program is not on the symptoms of COVID-19, the medical symptoms themselves, right? But in the mental health response to those symptoms and to the stress that comes about in being in quarantine, in being, having to take all of these steps to keep ourselves safe. So I think that the answer to that question is there's a basic knowledge base that is being put out by the Department of Health Services, fact sheets about the virus, but those in mental health positions will not be giving any type of counseling or any type of a consultation on medical issues. It's about mental health related to the virus, about mental health related to the sort of chronic racism and the loss of Black lives and other sort of vulnerable groups in our society right now that are suffering. So the emphasis, just to clarify, is on mental health as it relates to COVID-19, not COVID-19 as a medical illness.
And Eva, I can tell you, since between myself and Marina Makia Gadena, who's part of the legal team at the Archdiocese, her and I have been partnering on all the COVID cases within the diocese. I can tell you that nobody's an expert on COVID right now. It's still something that we're learning about every single day. And if you are watching the news, you know just as much as anyone else. Reminder to wash your hands, practice all the distancing. It's a little off-putting right now because many people are going out and they're feeling a little bit more comfortable, but we should all still be practicing all of the safety protocols like the distancing, wearing our face masks and everything else because the virus is still present.
Yeah. And again, just to reiterate, the focus on this partnership is with regard to mental health, right? Mental well-being.
In all capacities, yeah.
That's right. That's right. Other questions or comments or feedback, clarifications that anyone would like to make?
I have a question. In your experience with this model, are there any like challenges you could kind of emphasize? I know that you need kind of equal attention on each of the steps to really provide adequate care. And I totally understand kind of meeting people where they are and just the nuances with different age groups. But I guess for the average practitioner or the average, I guess, parish employee potentially who would be kind of working through the process of these 8 steps, would there be one or a few, maybe more than others, that you would expect someone to need like more training on, or more background education to really help somebody kind of work through what the whole framework? Does that make sense?
I think so. I would reiterate that the sort of starting assumption is that of being a first responder, right? A first responder, in a medical context, assesses for immediate safety, sort of stops the bleeding but doesn't do the operation, right? And so, those initial 7 steps, I think the one that requires the most training, the most time, in terms of technical sort of skill is number 7, right? Sort of, you're going to see the different fact sheets that you can pull to and try to connect people with information. It really is about fostering self-help in the person, and marshaling the strengths that they have within themselves and at their immediate disposal in their community, reconnecting them with those sources of strength within themselves and in the community. Number 8 is critical, because what you're talking about, I think, if I'm understanding what you said correctly, is how do you help someone more in the long term, right? How do you help someone sort of in a more sustainable way? And that really is the linkage for folks that need that. But you'll find, as I said, that working those first 7 steps is enough to have a significant impact on about 70% of the people that will come to you. People need help in a time of crisis to reorient and reconnect with the sources of strength. So again, that's safety. If you think about the 5 pillars that we talked about last week, safety, calm, self-efficacy, connectedness, and hope. Those are sort of the 5 goals that you're going for. The number 7 in the psychological first aid, as I said, you can think of as the bridge to skills for psychological recovery, which is a little bit more advanced. But as a first responder, you know, I think really trusting, you're going to get this field manual that will give you a little bit more depth and maybe help you feel a little bit more equipped and prepared. But it's designed not only for people that receive the training, but for people that have received psychological first aid. In other words, the people that you will work with, that then for them to take those skills and share them with others. Because the skills, the perspectives are perspectives and skills that can be deployed more broadly and that are going to help people regardless. It's less about the skill of the provider and more about the content of reconnecting with the strength within themselves and their communities. And it's designed that way. So
That makes sense. Thank you.
sure.
Well, perfect, Doctor. Thank you so much.
Okay, one clarification. I'm looking at the Zoom chat here. It says the suggested 5 visits in PFA. The suggested 5 visits, 1 to 5 visits, is for SPR, the Skills for Psychological Recovery, which will be the next training when we bridge to that recovery phase. PFA, or Psychological First Aid, is designed as a one-shot deal, right? If you meet with the person again, you can sort of reinforce the principles that you shared with them the first time. But it's designed as a crisis intervention, a first responder. If you have just one point of contact with the person, those 8 steps represent a model that will be the most effective.
Hence the first aid portion of.
There you go.
Absolutely. Fantastic. Well, perfect. Doctor, again, thank you so much on behalf of the Archdiocese and everybody at the Office of Life, Justice, and Peace, all of our parishes. Thank you all for being a part of this. Doctor, thank you for your time and for your consideration, thinking about us for this partnership. We're really excited to have it and take on these next steps.
Thank you very much. Thank you, and God bless everybody.
Thank you, everyone.
To be here with you. Take care.
Have a wonderful night. Take care.
Bye-bye.
Thank you.
Thank you.
Bye. And go UCLA too. I graduated from there a long time ago.
Go Bruins.
Bruins, yeah.
Thank you.
Thank you.
Bye.
Bye.